my name's Kelsey. I'm doing a joint program in public health and journalism at Berkeley. And it's a two-pronged approach, I guess. It's a qualitative public health analysis combined with documentary journalistic filmmaking. So the film, I'll keep talking about the two-pronged approach, but the film really has to do with one Oakland homeless encampment. And the public health side has to do more with a qualitative, larger look at how one encampment management policy in Oakland impacted multiple encampment residents throughout the city. Um, so, so in terms of background, on the public health side, the question is really like, is Oakland's encampment management policy sufficient enough to meet housing and health needs of Oakland's homeless population? And this kind of came about from Alameda County's latest point in time survey that 5,490 people are living without permanent housing, supportive housing, which was up by 9% from the latest count, which is where Oakland is based. And then on the journalism side, like to kind of back up a bit, when I was reporting on housing and homelessness a couple years ago, I got to know this local filmmaker and reporter Karen Creighton, who I knew was documenting this Wood Street encampment story and the closure of Wood Street in Oakland. And so I had approached her about, like doing an internship with her. So that's how the documentary, like journalistic side came about. And even though her work focuses only on that one Wood Street encampment, we're looking at, like four or five characters instead of a multitude of people. It really like kind of gives a visual angle to the larger like qualitative analytical side that will come later with the public health work. So in terms of the methodology, the on the public health side, there's a qualitative analysis with semi-structured interviews. There'll be snowball sampling. All of that recruitment is going to take place this spring. So this month, hopefully, and February and March. We're just kind of I'm just kind of waiting on IRB approval. I can get into that in a second. The journalism side is more of verite, like scenes unfolding, long form documentary, also with sit down interviews. In terms of the findings for the documentary production work, since that has been finished, like similar to qualitative public health analysis, we also codify information based on the data, or in other words, based on the interviews and the scenes that we captured. From those, we found eviction defense, different emotional themes, loss, hope, different interviews we did, legal, political advocacy. Some of the unexpected codes were talk of substance abuse and addiction. I don't think we expected people to be so forward with that. Cinematic art, city workers, interactions with law enforcement. On the public health side, like I said, that's going through IRB right now, and then any day now we're kind of going to finalize that protocol and then start recruitment. Since this project is so visual, I thought it made sense to like maybe include some of those photos so you can see like some of the advocacy, some of the destruction, the loss that will be present in the feature final film. Some of these characters, Lamonte Ford has been homeless for now over 9 years, and he's had his own he's dealt with substance use and mental health for all that time. And so we see that, but also like all the strengths and bonds that people have within the community. Um, yeah, just going down to section 3 with results. I already kind of talked about this, like all the codification, but here it is listed again. And then on the right, like just a picture of kind of going through that qualitative work, but in other words, it would be that journalistic editing work. So, assembling a sequence or a timeline the same way that we assemble a draft of our findings um, for final production in next spring, June 2026. So overall, I mean, I think for the journalism side, which has been more completed, we found a total of 20 themes for editing. we're continuing to draw from this narrative analysis to understand people's lived experiences. On the qualitative side, that recruitment and interviews are expected to be done by end of March this year. I think, yeah, and then just in terms of recommendations, like I said, we'll finish that documentary in the spring of 2026. But yeah, I think it's just taught me a lot about like the overlaps between these two fields, and you can be conducting interviews, whether it's filmed and transparent or qualitative, anonymous, and be protecting people's privacy and respecting like the ethics of both journalism and public health. So yeah, thanks again to University of Arizona, and I think I'll stop there.